This is OMS Voices and Amos Podcast. I'm Bill Klaproth, and with me is Dr. Bach Lee, who is here to discuss how the team approach to placing dental implants combines the best of modern science and technology. Dr. Lee, thank you for being here today.
It is a pleasure to be here, Bill.
Yeah, it's great to talk with you. So who is on the team involved in placing dental implants?
Well, the implant team usually depends on or is composed of the oral surgeon, the oral maxillofacial surgeon, and the restorative dentist. There's also a laboratory technician who also is involved in fabricating the restoration. So these are the important members on the team.
So the restorative dentist then is the person that is concerned with the smile, the final appearance of the surgery and the implants. Is that correct?
Well, I think everybody has a vested interest in the smile.
Okay.
But the oral maxillofacial surgeon is primarily focused with developing the bone, the soft tissue, and placing the implant. And whereas the restorative dentist is the person who takes the impression of the implant and fabricates the restoration and the crown that goes on top of the implant.
Got it. Okay, so then what role does the patient have in the dental implant surgery process?
Well, the implant is a process that does require the patient to be a willing participant, and the patient has to be compliant with all the treatment recommendations. The patient is very involved with the treatment selection, and also, most importantly, after the care is provided, we really want the patient to have follow-up. Mm-hmm. And implants are just like teeth in the sense that they do need maintenance and they do need care. You have to have good hygiene. So following up with the restorative dentist for regular recall. And often for me, I also have them follow up with myself so I can see how the health of the implant is doing. So the patient is part of this team.
Right. You don't want to go through this whole process of getting dental implants and then not have the person brush or floss or properly take care of their mouth.
Exactly. And we see that can develop a problem, yes.
Yeah. So why choose an OMS to place a dental implant?
Well, dental implant does involve surgery, and many times it involves complex surgery also. So oral maxillofacial surgeons are specialists in surgery and have, specialty training in bone augmentation, soft tissue augmentation, and the overall treatment plan. So they go through up to 4 to 6 years of training, especially just for these procedures. So choosing an oral surgeon is really choosing somebody who's at the top of the food chain in terms of their knowledge and their detail in making the best outcome for the patient.
Because at the end of the day, this is surgery.
Exactly. At the end of the day, this is surgery, and we want to make sure that it's not just placing the implant, but also if there are complications, how to manage these complications. So this is extremely important.
Well, that's where your training and your experience is very valuable because it is a surgery, as I said.
Absolutely. Yeah. Absolutely.
So does an OMS require a referral for dental implant surgery?
Ideally, it is important to have a referral, and this is important because you want this for continuity of care. Most oral surgery practice, in fact, some are only referral only. So in other words, you need a referral from either mostly by your dentist, and sometimes by your medical doctor. And that's just to make sure that we're all on the same page and we have the correct treatment and we can provide a comprehensive care for the patient.
So it is beneficial to have one then, to have a referral from a dentist.
Yes. Now, sometimes in some practices, we'll make an exception if you have an emergency or if there's pain, and sometimes you cannot get to your dentist, you can go directly to the oral surgeon. But for the most part, most oral surgery practices, it's better to have a referral from your dentist.
Right. So a dentist will refer you to an OMS. How do you know that OMS is good? You just trust that referral then? Is that how that works or generally?
Well, most OMS are trained, like I said, up to 4 to 6 years. So when you go to an oral maxillofacial surgeon and that have graduated from an accredited residency, you're going to be pretty much in the right hands, and most are very, very qualified. We choose most of the participants that, I've been in education for over 20 years. These are top-notch candidates that we choose from the dental schools. They're in the top of their class, And we go through a rigorous process of handpicking these individuals based on their academic performance, their hand skills, and their capacity. And so you're in good hands.
Absolutely. So you said follow-up is very important in this, and you want to see your patients afterwards as well. So you want to see how everything is taking. What is that, a 3-month after, 6-month after? When do you generally want to see a patient after you do dental implants?
Well, after the implant is placed, there's usually a healing period, and we'll see the patient back for follow-up in the postoperative period. So immediately within 1 to 2 weeks. And then after that, we have a wait period for the implant to integrate once, and then we do another follow-up to check on that implant to make sure that it's integrated. At that point, we'll clear the patient to go back to the restorative dentist.
Okay.
And and we'll pass the patient, kind of handing them off to the restorative dentist. The restorative dentist at this point takes over and starts their process of fabricating the restoration. Now, once that treatment is done, depending on what the complexity of the treatment, I'll have the patient either follow up. If it's just a simple treatment, they can do a simple recall with the patient every 6 months, with the restorative dentist every 6 months. And sometimes they'll do follow-up with me if there's further follow-up that needs to be needed because of the complexity of the treatment. And they'll follow up with me also sometimes every 6 months to a year.
Okay.
And sometimes we have them follow up every single year for many, many years.
Yeah. So that's kind of the circle of this team approach.
That's right.
Yeah.
Correct.
Yeah.
Yes.
Really interesting. So any final thoughts, Dr. Lee, regarding the role of an OMS in placing dental implants?
Well, OMS are pioneers of the dental implant procedure and are leaders in innovative techniques that deliver natural-looking solution for missing and damaged teeth. Their extensive training allows the OMS to successfully place implants in most patients, even if they are deemed to be high risk. So I think you're in good hands when you go to an OMS for implants.
Well, when you say at the end they're higher risk, you really need someone with the experience and education of an OMS to do this very complicated surgery.
Absolutely agree.
Yeah. Dr. Lee, thank you for being here. We appreciate it.
Thank you so much, Bill.
Yeah, you bet. For more information and the full podcast library, please visit myoms.org. And if you found this podcast to be interesting, please share it on your social media and don't forget to subscribe. Thanks for listening.
Thank you.